had been mentioning testing. Would love to kind of hear like the main tests that you might use with your clients. Just like a stereotypical woman that might come in complaining of like bad PMS, irregular periods, acne, just like a host of symptoms. And then also kind of what tests you would recommend for women that may have been dealing with the hormonal imbalance previously and are kind of in maintenance mode. Because this might be an assumption, it might be a bad assumption, but wondering if you're in maintenance mode, if maybe you don't need to get as many tests done, if there's a smaller number of things that you should kind of just be tracking.
Yeah, so most women, it's a great question, because there can be some differentiation based on how severe the symptoms are and where you're at. So most women that come to me, they've reached enough of a pain point that they're ready to see me.
Yeah.
Not always. Sometimes it is just a checkup, and they want some instruction and direction, and they're generally doing pretty well, but they have a few things. For the most part, women come in very symptomatic, very, especially like perimenopause, menopause, hot flashes, can't sleep, the whole symptom picture. So my favorite test, and the test that I run the most, I would say, is called the Dutch test. And that stands for dried urine panel. And that test really gives just a wealth of knowledge. If you have to do one test for a woman for hormone health, that is the go-to. If she only has so much money and so much time, and it's a test that you can do from home, which has been really advantageous, especially during COVID. And for busy moms that, scheduling an appointment and getting blood drawn and planning the fasting window and all of that's kind of a project. So the Dutch test, what it gives us is it gives us that cortisol rhythm, tells us about circadian rhythm, it tells us about melatonin levels, which play a huge role in a woman's ability to recover, and then in sleep. It tells us about even neurotransmitters. So it'll tell us about, dopamine and epinephrine, norepinephrine. So I can see if she's in a fight or flight state all the time. I can see if she has the precursors to make all of her neurotransmitters. We can see what her glutathione levels are. And this test stands out because it also provides a window, a picture into what's happening with a woman's liver detox of estrogen. And there's no other test that I know of that will do that. Blood tests, they don't even compare. They will not give you that information. Yeah. So we can look at all the metabolites of the hormones. And then if a woman is not detoxing her estrogens well, the Dutch test spells it out really beautiful in black and white and says, okay, it will turn into quinone, which is reactive and will damage DNA and put you at risk of estrogen-related cancers. And that's a huge deal if we can pick up early on, preventatively, if a woman's not detoxing her estrogens, if she's estrogen dominant, and not getting rid of them, we can prevent her risk of cancer through natural medicine. And I love that. I think that that's so proactive. And a lot of our medicine has been reactive. And so creating a proactive, let's help women support themselves better. They show up better in the world. They're better at their work. They're energized. And so I think, being able to address hormones in a holistic way, having testing to do that. And then the Dutch test also is really clear. Once I have the results from that, it's a 6-page report. It's really clear to me exactly what's going on and how to treat it. And so then we have a treatment protocol that's very individualized to that person's results. So if they're super high cortisol, we're going to give them certain adaptogens. If they're super low cortisol, we're going to give them, different adaptogens. But it's really individualized, which is the benefit of working with a practitioner and not kind of going out and picking out a bottle on the shelf and thinking, I hope this helps me. So it's very, very specific in how we go about testing and treating for hormone imbalance.
Yeah, no, that's awesome. Because it is, there's no one size fits all approach for this kind of stuff. And so having that level of detail is just so beneficial.
Yes. And there are other tests too. So I do run stool testing. If there's, GI symptoms, we'll do that. Sometimes it's a first. Usually it's those two tests that I'll run, the Dutch test and a stool panel. And then, a lot of times, if we can run blood labs, I'll look at vitamin D levels, I'll look at homocysteine, I'll look at some of those inflammation markers in the body if a woman has autoimmune issues. And then there's actually an in-home thyroid testing kit that I've been using recently with great success as well, that's helpful during COVID because I can do it from home and it takes 5 minutes or less.
Yeah, absolutely.
So
the at-home tests are really incredible for access and just convenience and ease. They're really a win all from all perspectives.
I agree. Time saving, just ship it off to the lab, ship it to your house, and you don't have to go anywhere.